right now, corporate America stands between you and your health care, and there's no argument about that.
I just had a situation recently where one of my patients fell and hit her head. And I was concerned because she was showing some abnormalities that she might have bleeding on the brain, something that's called a subdural hematoma. I had to call her insurance company to get approval for a CAT scan. And I was surprised when I had to actually spell subdural hematoma to the person on the other end of the phone that was making the decision of whether I could do that CAT scan. I got so frustrated, I hung up the phone, instructed the patient to go directly to the emergency room, where I'm sure the insurance company wound up paying 3 times as much to get that done. And unfortunately, that's what happens now.
Wow. That is just amazing.
The idiocy is unparalleled of the current system.
And I wish I could say it was a infrequent event that happens, but it happens every single day in my practice, which is just a small solo family doctor.
Right. Well, I think people who have insurance and have had any type of serious need for care have experienced the denials of care and the runaround that they get from the insurance company.
And why are those denials? Why do they exist? Because it's all about cost and profit. It's not risk management, it's risk elimination for the insurance companies, but it's put on the back of the patients as well as the providers of health care.
And what more do you need when you're dealing with a serious medical illness? Do you need to fight with an insurance company over every nickel that's spent? And when I talk to patients that are ill, I work as their advocate. I try to buffer some of that, but they all tell you horror stories about the bills that pile up. And we have a spiral that occurs in this country where when somebody gets sick, they lose their ability to pay for health care, they lose their job. And that's why the #1 cause of personal bankruptcy is medical bills. And most of those people, 75%, had insurance when they got sick. So it's not always a lack of insurance that causes you to go bankrupt, but insurance companies don't want to pay for the care that you need.
Okay, one of the points that is important, the public is misinformed on what single-payer health care is. We see people here today talking about single-payer here, and this must be indicative that we're making some progress, because never before when we were down here did we have people opposing us on single-payer. But what the media does, the mainstream media, it gives misinformation through the mainstream media as to what single-payer is. Single-payer is not socialized medicine. Single-payer is merely giving access to the broader public in America an option, a public option. That's all we're asking Senator Nelson today, is to introduce a public option.
Let me ask you a couple of questions about single-payer. So the single-payer would be the government, correct?
Correct.
Correct.
But someone could choose what doctor or what hospital they went to.
You would be able to have your choice of any physician in any hospital in the United States for your care.
Now, would your care be limited like it is with insurance companies, where, like you mentioned a minute ago, you had a woman who had a fall and you thought maybe she had a subdural hematoma, so you wanted to look into that, but you had to call the insurance company for approval and they denied it. Would you have a situation like that with single payer, where you might have to ask some government bureaucrat?
Well, the funniest thing is, when you tell that story, you're making a determination that's medically necessary that should be further evaluated with a CAT scan. Now, we all heard about the actress, Liam Neeson's wife, who died on the slope from not getting a CAT scan in a timely manner, etc., for a variety of reasons, which we won't go into here, and she died. So he's trying to do the proper thing, medically appropriate, and the insurance, this person that can't even spell subdural hematoma, is trying to deny him that, so he has to go through those costly route through the emergency room. That's not what we're talking about.
Now, but what I'm asking is,
if that patient, I think to answer your question, if that patient had Medicare, I would have just ordered the test and been done.
There you go.
oh, great.
There is no prior authorization. I don't have to call somebody. There is no government bureaucrat between me and the care of the patient.
And so,
but as soon as that Medicare patient signs up for a Medicare Advantage program, which is a Medicare HMO, then I have to jump through all of those hoops, because they're trying to, quote, save money and make sure it's appropriate care, which really is code for denial of care to maximize those returns.
So HR 676 that we're asking Bill Nelson to get involved in, at least opening some dialogue on, that does not propose putting people in a position where the medical providers have to call and ask a bureaucrat for authorization.
Not at all. And what the plan that I espouse, and I espoused single payer in 676 in 2006, but I have changed my implementation. I went to the John Edwards means of implementation because it offers choice rather than mandate. Is that the people, it's not socialized medicine from the standpoint the government's just paying for it. Everybody who is going to pay a premium to the government, so-called, like the Medicare premium Part A, Part B, that will be significantly less than any private insurance premium, and according to their ability to pay with a cap that no one would pay more at a maximum than anybody else. I say Warren Buffett wouldn't pay any more than Donald Trump. So this is not socialized medicine. This is a financing, a means of financing the cash flows to the organizations and the people that provide health care.
But just to clarify right now that one point, because I think that's a point that's got a lot of people confused. Right now, if you have health insurance and your doctor thinks you need a CAT scan, check for a subdural hematoma because you fell, you have to get...
Your care is rationed by the insurance company.
By the insurance company.
Whereas if you're a Medicare patient, your care is not rationed by the federal government.
Unless
you sign up with a private plan, they rely upon the decisions of your physician to determine what you need. And that's really the determination of medically necessary, not what your insurance company.
So by going to a plan where the single payer is the government, as long as we let the medical providers make the decisions along with the patient, then we're going to have better choice and better opportunity for quality care. Is that correct?
Absolutely.
So single payer, so what we've just summarized here is that single payer totally refutes the arguments against it by the other side on this issue, that someone's going to stand between you. Right now, corporate America stands between the doctor and the patient, as just illustrated here, and in single payer Medicare, the VA, the doctor or other healthcare provider like myself, a nurse practitioner, writes the order because it's deemed medically necessary based on the history and the assessment of the patient. Is that not what you want in a healthcare plan?
Right, sounds good to me.
Sign me up.
I think we got some good stuff.